All right, we are back with Catherine CVA and Steve Edmonds for the last segment here talking about Medicare and health insurance. Catherine, this is a tough question. This person says, why can't a person who has terminal cancer get Medicare?
A person with terminal cancer can apply for Medicare at the time that they have a diagnosis. And the unfortunate thing is that it takes time to get it through the system to be approved. My advice to anybody who is diagnosed with a terminal illness is talk with your provider and a social worker that works with them and start the application process immediately if you're going to be unable to work or you're very sick, because it does take some time for that to be approved, but you can apply.
Okay. Steve, this person says, how do they determine how much you have to pay monthly for coverage?
So that question can pertain to your Part B coverage, which is through Medicare. For most people, that's $174 and some change. But if you're a high income earner, that number can be more. Now, if the question pertains to your Medicare insurance, that's going to be the difference between if you have a Medicare Advantage policy or a Medicare supplement. A lot of Medicare Advantage policies are zero premium, and you're not having to pay anything for those. Whereas a Medicare supplement, which is richer in medical benefits, you're generally going to be paying probably $110, $115 a month at age 65 for one of those, but it's going to go up as you get older as well.
Okay. Catherine, this person says, I turned 65 in August. I have insurance through the Affordable Care Act. How and when do I make that switch?
Immediately when you turn 65. Affordable care basically turns off when you hit your 65th birthday, so you need to make the transition during that year.
Okay. It works just the same as if you had employer's insurance. If you have Affordable Care Act insurance, it doesn't make any difference. Okay.
Right.
Steve,
you need to make the transition.
Okay. This person is kind of following up on that question you answered. What's the difference between a Medicare Advantage or a Medicare supplement plan?
So a Medicare supplement is going to be a plan that is going to be your richest benefit for medical coverage. When you have that type of setup, generally Medicare is going to be paying 80%. The supplement's going to come in behind it and pay the other 20%. So really the only thing you're out of pocket with that type of plan is your premium dollars. And that's it, you know. A Medicare Advantage, on the other hand, it's going to be basically a zero premium type plan, but it will have an out-of-pocket annual maximum. So you won't be able to go over a certain amount before it starts paying 100%. But the really good thing about some of these Medicare Advantage plans is they have all kind of bells and whistle coverage, I call them. They've got dental, they've got vision, they've got hearing, they've got over-the-counter drug coverage. So there's just a lot of coverage with a Med Advantage product, but it is not as rich in benefits. And you likely, if you have a lot of sickness during a year, you probably will pay more out of pocket with a Med Advantage plan than you would with a traditional Med Sup.
Okay. Catherine, this person says, will Medicare cover a home caretaker for a few hours a day?
Medicare generally does not provide for home care, but there are some exceptions, and that is if the person is on hospice, part of the hospice benefit is provided from that. But if you have long-term care insurance, that long-term care insurance may provide home care assistance to you as well.
Okay. This question makes me crazy. My husband turned 65 in May. He's called Social Security. They told him that if he's still working, he doesn't need to apply for Medicare because he works for a company that has insurance. The current employer needs to complete certain forms. Why would they tell him that when obviously he needs to enroll so he doesn't pay a penalty?
Yeah, that's probably not the best of information there. What I would advise the person is they need to go ahead and sign up for Part A Medicare. Go ahead and get that going because it's free. You don't pay for it, so you might as well have it, you know. And then the Part B, you can defer it, as Catherine alluded to a while ago. You can defer it for 1, 2, 3, 4 years, ever how long you're going to keep working and have your group insurance. You can defer it till that time. But by all means, go ahead and sign up and take Part A, because the bottom line is Medicare insurance and your group insurance, they can coexist and live together. So, there's no downside to that.
I know. I just hate to think, Catherine, of all these people paying penalties.
Absolutely, and the penalties never go away. That's the worst part of it.
All right, thank you both for your time and your expertise. Of course, we will have you back again because we got all these questions. If you missed any of this, you can rewatch these interview segments in the Two Wants to Know section.